going to do, I think our program is going to be pretty quick so we can invite discussion. That always tends to be the most exciting part of the work that we do. We'll do a brief introduction. So my name is Elizabeth Speidel. I am the Director of Community Engagement at New Jersey's Long-term Care Ombodusman, which advocates on behalf of people living in long-term care facilities. And I'll let my buddies here do a quick introduction of who they are, and then I'll start again. And I'm just going to do a shout out to Melissa Chalker, who was like, "This is Ray. This is because of you." Let's start with you.
So I'm Ray DiFrancesco. I'm the resident at Carnegie Post-Acute Care in Princeton.
My name is Gary Brown, and I'm a resident at Carnegie Post-Acute Care also.
So I'm just going to go with a brief introduction about what community engagement is. It's a program that's fairly new to the universe of the Ombudsman's office. It started about a year ago with me being hired, and then we started with residents. Ray was our first resident, connected to us by Melissa in the audience when he spoke at an age-friendly event. And then growing to more and more residents, including Gary, and then we have some additional staff, a few of us who are here today, including Tot, and then Amy's here too, who works with us from the Ombudsman's office. And the idea behind community engagement is that it's really rooted in the idea that the people who are most impacted by whatever policy or actions that happen should be centered so that we're listening to their voices making decisions, whether we're responding to an issue that's come up and then we reach out to people, or that the issues are coming up from the residents themselves. We have a statewide resident group that right now is about 15 residents of long-term care facilities. We meet bi-weekly with people coming in as they're able, discussing different issues. The primary things that we work on are both global. So those are issues that affect residents throughout the state. And those global issues either emerge from conversations with residents where residents want to go, or also we're responding to something we want residents to be the voices that are responding. So an example of that, recently there was a report issued by a firm that the governor's office had hired to talk about what happened during COVID. The people who spoke for our perspective were resident family members, and we wanted that. And so they were giving their input to that action report. And that just was released. It's a light, breezy read, only about 900 pages. So feel free to read that at your leisure. And then also, we had the federal regulations around staffing. The proposed regulations came out last fall. We worked with about 20 residents to submit comments on their own behalf, in addition to the Ombudsman sending comments. So those are issues that we kind of respond to. But then issues that are emerging from residents are, as many of you may know, the increase for people who are on Medicaid, they get about $50 a month that they get to retain of their income. That's a woefully small number, and a resident-led effort that we're helping with is to increase that to $140 a month. And we'll be sending more and more information about that. And then facility-specific, we work with resident councils. That's really the voice of many residents within a facility. So right now we're working with about 13 facilities around the state, specifically working with residents to help identify what are the issues that are most impactful for them and what they would like to see in their home. And now I'm going to turn it over to the people that you're most interested in hearing, Ray and Gary. And I'll let you guys duke it out about who wants to go first.
All right, Ray.
All right. Well, I will say one thing, that when you come into a nursing home, you're kind of stripped of all your identity as part of a community, right? You're ripped from your neighborhood, and many times you're even ripped from your friends because sometimes they put you in a home that's not even close for them to come visit. You're put here with people you don't know, and then you're put in a room with someone you've never even met before. So getting a sense of belonging is really kind of difficult. And a sense of community is really important within the organization. Also, you're kind of, I hate to use the term, but under control of the management because they set the rules, they determine a lot of factors for you. And you kind of have to accept it because you come into this situation very vulnerable. So what's really great about work that Eliz and the Ombudsman's office does is it first gets us to understand what our rights are. And Gary will talk more about that. But it also gets us to learn how to work together as a resident council, as a community. And what's really interesting is that we're a sounding board for each other. Because after a while, you start to think we're going crazy because the manager sometimes talks about things and they make it sound like it makes sense or it's fact, and it really doesn't. Our biweekly meetings across different nursing homes is where we really talk about things we're going through and share stories. And it's amazing common thread you hear. How we handle lockdowns, COVID. We're dealing right now with the thing about telemedicine and teleappointments. How do you handle that in a nursing home environment? Different things like residents' rights, how to make sure people understand what their rights are, and then sharing experiences between different resident council leaders because there's no training for us. We get kind of thrown into these positions or no one else wants them. So big mouths like Gary and I, take over and fill the void. But we're kind of making this up as we go. So we're trying to figure this out. And a lot of times management doesn't like us to know, right? They want to be able to control us and they set the rules and they're kind of like over authoritative parents in like the 50s where you don't question, like father knows best. And, you don't want to be called down to the principal's office or to the, supervisor's office or the managing director's office, because then you're really in trouble. And they tend to work with us. There's kind of that culture in a lot of times where we share stories between the different facilities and learn from each other, encourage each other, and really support each other. And that's why I know for this program has been really important for me. And it's actually, when you're doing it, it's actually fun because you got this whole new network of people you're working with. And as you're seeing right now is when you're in a facility, you never have peace and quiet. We're in a room that no one uses, and the second you walk into the room, people use it. So that's someone using a vending machine right next to us. Gary, what else? What would you like to throw in there?
Well, you pretty much touched base on everything, but for me, I wasn't here by choice. I wasn't that my family brought me here, nothing. I was in a bad car accident. So when I came here, I was just basically trying to heal. But as the healing process keeps going on, you start like recognizing what's going on around you. And you start wondering, like, is that right? Do I have a say so in this? Or I don't like the way they're treating this person. Is that right? And so, like my first 8 months here, I never knew nothing about the ombudsman. It was never brought to our attention, what the ombudsman stands for or what they're here for until, we really started talking as a group. And then the ombudsman office started coming in and letting us know like what's available to us, what our rights are. And it's made life a little bit more better because, like Ray said, the parents of the 50s, kids are to be seen and not heard. Now we actually have a voice. We have the meetings, we take notes, we can call them on things that they can correct. There's no more, well, we'll take care of it, and they never do it. We can always bring it up to them like, well, you said that 3 months ago, and you still haven't made a change. So, ombudsman, like, really gives us a chance to, like, really not only make it better for us, but for the people after us. And that's the main concern with me is like if I have the opportunity to leave, I don't want the people behind me stuck in a situation where they feel like, they can't speak on what they don't like or know what their rights are.
Yeah, they do. They try to, and goes across a lot of facilities, not all. They try to intimidate us to a
Right.
certain extent. And there are a lot of people here who can't literally speak for themselves, let alone figuratively.
Right.
And Gary and I are probably in the situation where we will leave here.
Mhm.
And I think we kind of bring a unique perspective, as both of us came in here very sick. And we
Right.
came in here to heal, and we went from being bedridden kind of backwards to what most of the people do, to being healthier.
Right.
So we remember all those horrible stages that we went through. While most people are going down, we were going up.
Right.
So it gives us a different perspective on, how scary it was to be picked up in a Hoyer lift and worried
Right.
they're going to throw you against a wall.
Right.
Or, being in bed. And I hate to say this, they don't respond to your call button and you've soiled yourself. And you have nothing you can do about it except for lay there. And those are very real memories for us. Sometimes when we talk about them, things I don't want to remember, but it's kind of good that we do, because then we can talk about it.
Right.
It's Ray said that it can be fun, and I have to say the best part of my job is getting to work with residents, and we get to work right within a facility, but also across the state and even across the country. Some of the projects that we're involved with are going to be models that'll be used in other parts of the country, whether that's working with around resident councils, or Gary's a part of a national advisory group for advocating within long-term care facilities. So having the voices of people is it's just critical. Like those of us who are doing the kind of more policy and work can be something like we can say things, but it's just way more powerful, right? Like, isn't this better to listen to Ray and Gary than just listen to me say what Ray and Gary?
Yeah, early on, someone said it's like sometimes you feel like you're screaming in the woods and no one's hearing you. And this program helps us be heard. And I know that sounds a little cliche, but our voices are important. And even when the little things that you can accomplish make people feel better about themselves. So you got to take those little victories sometimes, even though they may not be major. Just bring something up in a meeting and knowing that got done and it was done quicker because we talked about it, is a little victory, but does help. So they're baby steps, but they're important ones.
And you've talked about even within the council, like you can see a shift in the work that's happened about how people and how administration and staff are responding. Right. That matters.
No choice.
Yeah.
Yeah.
No choice.
Right.
Sorry, guys.
Yeah.
Miss Elizabeth, hi. I'm so grateful to Ray and Gary, and I want to group hug your bravery. And I'm so grateful that you're getting more healthy, and I send you all the great blessings to get up on out of there and become purely independent, amazing souls that you is. The work that you're doing and speaking out changes so many lives. I wanted to ask about backup generators, because I seem to be asking a lot of different forums. It was alarming to learn that when COVID happens, some of the homes that the people they lost their lives because the power be out. Superstorm Sandy happened many years ago. That was another thing. I'm alarmed because our state, and now I heard Biden is moving to push for the electric vehicles. That's going to strain our infrastructure of the power grid more. My lights flickered just because of the wind the other day. So when you're in a home and you're going through these stages of needing medical equipment, like what you said with your call button, the power goes out. Is that part of considered the healthcare quality protective factor of life, the necessities of needing the power in place and having the backup generators as law? Like, is you think somebody can bring that topic to the conversation? Because we're so dependent on the electrics for quality of life. So many people need the oxygen and the CPAPs and the this and the that, you know what I mean? Like a power lift. And I
Yeah,
just
I
want
hear
to
you,
know
Jean
if
Marie.
that's part of the conversates of protective factor quality of life in the homes.
So, Jean Marie, just thank you for your question. And that can be, it's not been an issue that's been raised significantly by our residents because they have other priorities, but it would, in theory, be something that could be talked about, for sure.
Especially when they transition home. Like if they're still on medical equipment and now they're home, like it's just, we're considered a progressive liberal state, right? And it just alarms me that, you know, we pride ourselves on group hugging, caring for protective factors of life. But when Gary and Ray, they're so much more healthy now and they get out of there, like what's the protective factor going to continue with them so they don't become having to go back into that situation, you know, like that's my concern.
I hear you, and thank you for that. And I just, we have such a limited period of time. I'm going to go to the next, I think it's Takashi, the next question. And then we also have one in the chat.
Yes. Hi, my name is Takashi Amano. I'm assistant professor at the Department of Social Work at Rutgers, New York. I am working with, in the community, I'm working with Japanese older adults. And just yesterday, I heard the story about Japanese couples who are in independent living. So wife cannot speak English at all. So the husband is taking care of all the stuff if they need English. I am so worried if husband died, what happens to wife because she can't speak English at all. So my question is, do you have any like language service for residents whose primary language is not English? That's one question. And I'm also my research focus is on dementia. Do you have any like particular program or services for people with dementia?
Sure. So the first question about this is something that, right, Gary was just saying, it definitely comes up within a facility, and it's the responsibility of facilities to be able to provide care in a language that the residents understand. And there's ways that can happen, right? Like language line. And if they have, right, they should know the residents that they have who don't speak English or who would like to speak in their first language, right? You mentioned dementia. As dementia progresses, even if somebody did speak English, that might not be available to them as their disease progresses. So one of the things is, so the facility should be able to provide that. And if there's not, that's something that can always, people can call the ombudsman's office. Because a lot of times what we do, right, like we deal with really significant issues on the investigative piece, but sometimes we just remind facilities of what their obligations are and help them prioritize what's needed in a given situation, and then can kind of direct them to the resources that they need. So that's kind of addressing one issue. And that's something that we can use too, I think, within the state around language lines, so we can work with people who don't speak English as their first language.
I also think from the dementia side of it, one thing you didn't talk about is the importance you have, and you're just really starting to build out family councils.
Yeah.
And I think that's where they impacts a lot of the people with dementia. Do you want to talk about that for a minute?
So we focus this first year on working with residents because we feel that they are the most impacted. And then we're also beginning to work with families because, especially for residents who have dementia, the families often are their voice. And so working with that. But, you know, Ray is the resident council president here at his facility. And one of the things that he's interested in, how do we incorporate working with residents with dementia to make sure that they're, you know, living their best lives within a facility. And while families are absolute advocates for residents, one of the most profound things that I have seen is the way residents, and you heard Gary talk about this too, and Ray, that the residents are really advocating not just on their own, but on behalf of people who need support, who can't do that on their own, right? Like where their voices are not going to be as heard.
Well, I think sometimes we know better than the staff does. We have one resident here who is an absolute joy, and he has problems with his hands. but he likes to eat dinner with us and lunch, and he comes in, they kept giving him food and he can't eat with a fork and knife. But I talked to the dietitian and I said, can you get him finger food at lunch? And they give him finger food. And you know what? He looks forward every day to coming to the dining room, sitting with us, having a sandwich or finger food. He doesn't care what we're eating. He just wants to be able to eat on his own with us. And I think that's an example where we as residents know each other better than the staff does, and we can help advocate for each other, even in little things. And then we had a major situation here where one of our residents was being told she couldn't do a telemed conference on her own. The nurse had to do it for her. And this person is totally cognitive, right? She can handle it. She goes out to doctor's appointments all the time on her own. No family, nothing. And then they're telling her she can't do it. That's where me as the president get involved, right? And I go to the social worker and the head of nursing and saying, this isn't right. And sometimes that makes me not one of the most favorite people here in the building, but yeah, it's the little things that when we need to step up for the big things.
Thank you so much, Takashi.
Thank you so much. It was very, very, very informative. Thanks so much.
We have a few more minutes, so I just wanted to check in to see if there are any other questions.
Did you have a question in the chat?
Oh, yes, there was a training question. Thanks, Ray. Is there any kind of training given to residents on communicating the challenges on the organizational side or building consensus or negotiating? Carol, thank you for that question. And there isn't yet, because we're in the process of building that. One of the programs that were one of the priorities for this year is building basically a resource center for residents. And that's going to look in a number of different ways, both having resources that people can do, us coming out to be supportive, working with volunteers. There's a lot of ombudsman volunteers in facilities, about 150, to work with residents.
And always growing. You guys are working really hard to get new people in.
Yes, always growing. And that the idea of training for that. And I love what you addressed, right? Like organizational, so building consensus or negotiating. A lot of times what we hear is like, listen, the residents are in charge of their resident council. Like we can't do anything. And the response to that is, there are a lot of skills that we are not trained in just generally as human beings and as adults. Building consensus, negotiating conflict, right? Like being comfortable with conflict. What's the difference between kind of personal insults and people just being frustrated?
Right.
And really, so that's part of what the work that we're doing is about how to build together. There's so many implicit rules that govern the way we are supposed to do things that we don't realize. We need to call those forth when you're in a community. As Ray said, like you're coming into a building where you don't know anybody, and you have a roommate all of a sudden, like things that we have not had to deal with before, without giving people real opportunities to learn about how we build community, how we listen, how we like engage with difference.
Yeah, it was a while ago, I helped develop a training program and in-service for the staff. And it was, when I showed it to Eliz, first she poo-pooed it because she didn't write it. But no, she said, everything you said is so basic. And I said, but when I gave it to the staff, things like, the first thing I say is, okay, what do you love about being at home? It makes you feel secure, you're in control, all these things. I said, okay, you come live in a nursing home or a facility of any type. Tell me how you feel. Everything that makes you feel comfortable is just stripped away, right? It's all gone. How people speak to you, all of it's done. And so you have to readjust your life. And then the staff has to really learn to think the way in our shoes, right? And it's a whole mindset that we really haven't worked enough on. And also training how to people to do it, how to work together, how to understand patients, the one dynamic we have here and is there's always contract nurses and CNAs in any facility anymore, basically, because of the nature of it. How do they manage it? How do we talk to them as residents? How do we work with the CNAs who don't know us to build mutual respect? So it's a great experience when you have a CNA who you never seen walk in your room in the morning instead of knowing it's the worst feeling in the world. Right?
I'd just like to jump in here and let the room know we have about 3 minutes left till we'll go back to the main room.
Yeah, and I saw Carol come off mute, and that was Carol's question. So I just wanted to give you an opportunity to speak.
Yeah, I just wanted to say thank you. I guess my my thought was that I have had relatives in nursing homes. I currently do as well, but I was also thinking that residents may ask for changes that just aren't possible. I've done a lot of work on the government side as well, and I know they're just. I wondered about training from the standpoint of residents feeling like nothing is being done when the organization really is trying, but there's like certain hurdles. So I think you addressed it.
I think a lot of it is about communication.
Yeah.
We tell them, and I was in a resident council meeting yesterday, and I said, okay, we can bring things up. They don't have to do them, but they have to give us a good reason why not.
Very good.
And it's a lot of frustration comes from lack of communication. I think that's the best way
And
to handle it.
okay, thank you very, very much.
Yeah. And also things take time.
Yeah.
And so part of it is not simply waiting until the issue is resolved till we come up, but like, these are the steps we're taking as we're going through. Like, it makes a huge difference. And people don't like saying no, and I can't do anything about it. So they just don't say.
You froze.
Yeah, Gary, Ray, Eliz, we're not able to see or hear you anymore.
Miss Sarah, what home are we allowed to ask? It's a little on the personable side. What home is the Gary and the Ray in?
Oh, I do not know that.
Okay,
I
or
can
if-
answer
a
that
little-
for you guys. So my name is Tatiana. I'm also part of community engagement. I'm not with them currently. I have to go to another meeting, but they are currently at Carnegie Post Acute Care in Princeton, New Jersey.
Okay, thank you, Miss Tatiana.
Oh, are they back? They're back.
Yeah.
Yeah, Eliz just said, this shows you that internet in facilities like this are not really reliable. And to be honest, they're not even good across the whole building. We have certain rooms where it's good. I have to go make a cell phone call. I have to go out of my room into the hall. But it is, you take the little things, you make very actionable things that you can accomplish. You accomplish some of the things that take longer. You have to be consistent, and you have to show where you're moving and bring people along the path with you. And that seems to make people at least feel better about if they can't get everything that we want done.
Got it. Thank you so much for addressing that.
I think for the first time ever, we might be on time, right? I think there you go.
There.
Yes, everybody can leave the room and go back to the main room. Thank you.
Thanks, everybody.
Thank you, Gary, Ray, and Eliz.
Thank you.
Thanks, Todd.